Now we are going to work on exploring anteriors. Remember, with your anterior teeth, you have surfaces towards you and surfaces away. But when we determine surfaces towards and surfaces away with the anterior teeth, we split the tooth in half. So I'm talking about a right-handed clinician in this video. Left-handed clinicians, exactly the same, but on the other side, okay? So I colored all the surfaces towards me in black. So I'm starting from 6 to 11. So number 6, surfaces towards me, is the distal aspect. Number 7, distal. 8, distal. 9, mesial. 10, mesial. 11, mesial. So all my blacks are surfaces towards. All the orange, surfaces away. This applies for the linguals as well, and the lower facial and linguals too. Now, if I was a left-handed clinician, the orange is surfaces towards, the black is surfaces away. Now, I know in the previous video and what I've been telling you with the other instruments is that when you are exploring or when you're using your instruments, we always want the terminal shank to be up and over. So if we're looking at the anterior, this would be up and over. However, we are going to be doing anteriors across, which means that our terminal shank is going to cross the tooth. So right now, if you look at my terminal shank, it's parallel to my tooth. But if I turn the instrument over, you see the terminal shank is crossing the middle of the tooth, okay? So this is anteriors across. This is the correct end for the surfaces towards me. So now this is the correct end of the instrument. Remember, we're looking at that little V, the bend there. So if you're looking at the terminal shank. When you're adapting your Explorer, if you're adapting your Explorer to the anterior, we start at the middle of the tooth. So posterior teeth, we start at the distal buccal line angle. Anterior teeth, we start at the middle of the tooth. Now, I want you to look at the adaptation. So I'm adapting here, surfaces away, the orange. So if you look at the tip of my Explorer, you see that the tip is poking up, let's come here, into the gingiva. So that is the wrong end. That end is not correct for surfaces away. You see here, it's not crossing the middle of the tooth. Now, if I flip my instrument over, use the other end, you can see how the tip is now into the tooth. It's hugging the tooth. The instrument is adapted to the tooth. This is the correct working end, okay? See, even if I come across into the mesial aspect, you can see how it's wrapping around the tooth. The working end is wrapping around the tooth really nice. Remember, we only adapt the lateral 1/3 of the working end. But you can also see my terminal shank is crossing the anterior tooth. Okay, so that is correct here. Now, when we're exploring, we work in sextants. For now, I want you guys to start with this now. Later, I'll teach you a different concept. So you do the posterior sextant. Now we're going to work on the anterior sextant. All the surfaces towards us, all of them, starting from this position. So we start at the middle of the tooth, surfaces towards, and I'm starting from the tooth furthest away from me, canine furthest away. Drop below the gums and explore. Remember, your strokes are still 1 to 2 millimeters. Go into the interproximal, 51%. Come up till you hit the contact, and then you'll come out, okay? Then you'll go all surfaces towards you now. So now you'll start number 10. Surfaces towards until you hit the contact. Now I've done all surfaces towards. So I do number 11, 10, 9, 8, 7, 6 surfaces towards me. I'm at 8 o'clock. I stay at 8 o'clock, grab my mirror, and now I would use my indirect vision, stay at 8 o'clock, and work at all surfaces towards me again on the lingual aspect, okay? Then I would come to 12 o'clock, switch my positions to 12 o'clock, and do surfaces away at 12 o'clock. Now, when I do 12 o'clock, I would start with the canine that is closest to me. So now I would start with number 6 to number 11 on the facial, 6 lingual to 11 lingual. But I'm staying at 12 o'clock for my surfaces away. And on the lingual aspect, I'm going to use my mirror. Indirect vision is extremely important. You must practice your indirect vision in order to master it. So use the mazes, use your mirror as much as possible, and get used to it. Remember, if you're getting caught on any of the gums, you're not adapting right. You're not rotating enough. So make sure you rotate your instrument more. If you're rotating and then your fingers split, like your fulcrum start to split, that means you're not pivoting on your fulcrum. So even though you need to roll or rotate the instrument between your fingers, you also have to pivot or move on your fulcrum as you're rolling. It's a very subtle movement, but you have to do both. So I'll show you here on number 7 so you can see it better. So I'm on number 7, drop to the base of the pocket. Am I in there? Yes, okay. Now I'm rolling the instrument into the mesial, but I'm also moving my fulcrum.